All right. Hello and welcome to another Walk with the Doc or Move with the Doc, I should say. I'm Dr. Rupa Shah. I'm a family physician and health and wellness coach. I've got over 20 years clinical experience, and I'm really excited to be kind of kicking off the new year with our series. I think we've got some really interesting topics lined up this year and really timely topics too. So hopefully you'll find them interesting, engaging, and if you have any thoughts or ideas, please send them my way. So again, the purpose of these talks is just to give you a very short educational talk on different topics that might be pertinent. And then you just spend the next 20 to 25 minutes listening, but also just moving your body, whether that's walking, jogging, stretching, maybe doing some light weights, anything that kind of gets you out of your chair for the day, and just a way to incorporate a little movement into your day. So that was sort of how the genesis of this program came along. And so hopefully you'll take advantage of that. So I'll save some time at the end for questions for the folks that are on live. So it's, the start of a new year, and many of us have probably made some New Year's resolutions that might include to start focusing more on our health and our well-being. This could include healthier eating, maybe exercising more, and maybe even to start taking some vitamins and supplements. So that's what today's talk is really focused around. We're going to talk about some of the different vitamins and supplements that are out there, whether or not they're really worth it, versus which ones might really offer us some real health benefits. So in a perfect world, of course, we would all be eating this very balanced, nutrient-dense diet that's really just chock full of different healthy fats and various fruits and vegetables, adequate protein, adequate fiber. And theoretically, then we wouldn't need to take any additional vitamin supplements in order to balance out our diet. But for the majority of us, including myself, that's not really true. It's very hard to eat in that manner, even if in a perfect world we'd like to. So we're going to talk a little bit about some of those supplements here today. But another thing that I just want to start off by saying as we go into this talk is that there really is no real substitute for a healthy diet. So meaning you really can't supplement yourself out of a bad diet, poor eating, poor diet, but you can fill in those gaps. And that's what this talk is really about. Just how to get maybe a little extra leg up, boost your immune function a little bit, get a little bit of some of the things you might be missing. But you do have to ensure that your base diet is balanced as possible, right? That you've got a good variety of foods, and that you're not eating a lot of those kind of fatty foods that are high in those bad fats. So omega-6, inflammatory fatty acids, right? A diet that's high in sugars. We don't want that. We can't be eating those foods and then think we're going to add supplements to get healthier. It just doesn't work that way. So again, it can really be difficult to get the recommended amounts of some of these vitamins and minerals from our diet alone. And that's why it's really not unusual to hear that taking a multivitamin or supplement on a daily basis can make some good sense. So if you feel like you're not getting your recommended amount of vitamins and minerals, it might be worth investigating a good multivitamin. There are certain populations of people, especially if you're vegan or pregnant women and certain other categories of folks who may have higher needs for specific vitamins too that might be better served by taking a supplement. So which supplements are really worth taking? There's very few that I feel strongly about that can be helpful to boost your health and wellness. But the first one I'm going to talk about is calcium and vitamin D. We've talked about this one before, but getting adequate amounts of vitamin D and calcium we know can help slow the progression of osteoporosis, which can then reduce your risk of having bone fractures in the future. There's also a lot of research ongoing that suggests that maintaining a good, healthy vitamin D level can reduce the risk of developing muscle aching, muscle pain, autoimmune disease, even maybe like rheumatoid, multiple sclerosis, and even certain cancers and cardiovascular disease. So that's vitamin D. There's also, the calcium portion of it, which most Americans aren't actually getting enough in their diets. Calcium supplements can help prevent deficiencies. Again, that can lead to bone loss, brittle bone disease like osteoporosis, but needs to be combined with your vitamin D. So calcium plus vitamin D can be used to treat osteoporosis, or even if you have just low bone mineral density, or what we call osteopenia. So you haven't yet developed osteoporosis, but you're just on that borderline, then you really do need your calcium and your vitamin D. Vitamin D is a level you can get checked as a blood test. So something you can talk to your physician about at your physical exam, especially those of us living in these colder climates, northern latitudes. We are lacking in vitamin D. So it is a good thing to get checked and then to supplement yourself. Again, climates with low sun exposure and folks with darker skin are particularly at risk. So the goal for vitamin D is about 1,000 to about 2,000 IUs or international units per day. But if you're low, your physician's going to want to supplement you with pretty high doses until we get you into that normal range and then maintain you with about that 1,000 to 2,000 IU per day. So think about that. For calcium intake, we recommend 1,000 to 1,200 milligrams per day. And we like to get that spaced out about 500 to 600 milligrams throughout the day. Okay. So that's one that I do like. I do take myself, calcium and vitamin D, also knowing that I have low vitamin D. So again, if you're curious, you don't know, talk to your physician about that. The next one that I want to talk about that people don't really think of as a supplement, but it is so important to our overall health, is fiber. So most people think of fiber supplements only if you're constipated, but a high intake of fiber really has a lot of other health benefits for many health conditions, ranging from heart disease, obesity, diverticulitis. So it's a good one to consider this year. The National Academy of Medicine recommends about 38 grams of fiber a day for men younger than 50, 30 grams a day for older men, and then for women, 25 grams a day younger than 50. And if you're older than 50, 21 grams a day. So whole grains, fruits, vegetables, nuts and seeds, you've heard of these. These all have a lot of good sources of fiber, but many of us do need some extra fiber to meet those goals. And if you need a supplementary fiber, you could consider psyllium. This one also has the added benefit of lowering cholesterol levels. So I think fiber is a good supplement to consider. Remember, let's talk actually real quick about some of the other benefits of fiber. I just mentioned it can help reduce your cholesterol. So fiber's presence in the digestive tract helps reduce how much cholesterol you absorb from food. Fiber, we've talked a lot about in some of the other talk last year, fiber can really help us maintain our weight. So it can help promote a healthy weight. High fiber foods like fruits and vegetables tend to be lower in calories. Again, it can also help slow digestion in the stomach. So it'll help you feel fuller for longer. So again, you won't be tempted to eat as much throughout the day. So it's another benefit of fiber. And again, it'll add bulk to the digestive tract. So if you do struggle with constipation or kind of like a sluggish digestive tract, you really do want to consider adding fiber. It just naturally adds that bulk to your body, to your digestive tract, because your body doesn't, digest that. Okay, and that can help stimulate the intestines. So. It can also help promote blood sugar control. So it takes your body longer to break down fiber in your diet when you eat it. This helps you maintain more consistent blood sugar levels. So I do always try and encourage my patients with diabetes to incorporate more fiber into their diet, especially first thing earlier in the day. So we know fiber can help also reduce risk of GI cancers. So enough fiber can help with protective effects against certain types of cancer, including colon cancer. And we discussed this last year as well. Um, and then lastly, my favorite, of course, just having enough fiber can really positively impact those bacteria in our gut, or what we collectively call the gut microbiome. So just building up healthy gut bacteria and building up a healthy gut microbiome does depend on having good fiber in your diet, whether you get that from food or a supplement. So something to think about. The next supplement I wanted to kind of mention, because you've heard a lot about it, is omega-3 fish oil. So for years, we found that people that incorporate a lot of fish regularly into their diet do enjoy some protection against heart disease and stroke. For people with cardiovascular disease who don't eat fish regularly, though, taking a fish oil supplement, I think, is reasonable. People who eat fish maybe like twice a week probably aren't going to benefit from this. But I think that for those of us who have risk factors for heart disease, say you smoke, you have high blood pressure, you have high cholesterol, or if you have a family history of heart disease, this might be a supplement you might want to consider. It can have some drug interactions, so do talk to your physician about it to make sure it's safe to take. But I do think even for my patients, I do recommend omega-3 fish oil supplements to certain patients. Again, they fall into this category of being at risk for heart disease, or they have a very strong family history of heart disease. For the rest of us who are younger, does it really make sense? The jury's still out. It's hard to say, but I think if you fall into a high risk category and you have other risk factors for heart disease, this might be one you would want to consider taking. So let's move on to the antioxidants. You've all heard of these as supplements. This is a popular one I get asked about. Vitamin E, vitamin A, beta carotene, vitamin C. These were all really touted back in the 1980s and even early 90s. But then there was a lot of very careful, randomized, controlled clinical trials that were done. And really, a lot of the benefits that we were sort of touting about them didn't really come to be true, actually. And most of those claims were it benefited against heart disease and cancer and other illnesses. And really, that wasn't sort of the worst of it. They showed that high dose of vitamin A actually increased the risk of hip fractures when they did these studies. And also high doses of vitamin A were then linked to prostate cancer. They found beta carotene could maybe increase risk of cancer in smokers. They found vitamin E could increase the risk of prostate cancer, could increase the risk of respiratory infections, heart failure. So I think the party line for antioxidants right now is don't take them. They're probably not going to benefit you. In fact, they could cause some harm. There's probably no real great reason to take these. There's one exception: folks who have moderate or advanced age-related macular degeneration can benefit from some of these special antioxidant supplements, and your ophthalmologist would discuss these with you. But I think for the average population taking these antioxidants, while it looked good theoretically, the clinical trials didn't bear that out. But that's not to say that eating a whole range of different fruits, and remember, these antioxidants are included in the skin. So eating the rainbow, colorful fruits and vegetables, bell peppers, yellow, orange, green, red, that all is all antioxidants. So taken in food form certainly seem to be helpful and protective, anti-inflammatory, but when taken in high doses in a supplement form, didn't really bear this, out, like I said. So continue to eat your fruits and vegetables, but in terms of taking it as a supplement, would not recommend. So moving on, a big question I get a lot, or actually I see folks taking and adding to their diet is protein powder. Has become super popular, people adding it to their smoothies and different things, or just taking it as like a pre-workout, post-workout sort of thing. So, so I want to briefly talk about that. So there's different forms of protein. These protein powders come in different forms of proteins. So they can come from plants, so things like soybeans, peas, rice, potatoes, hemp. They can come from egg, or they can come from milk proteins, casein, whey protein. Those are all milk-based. The problem and the issue sort of is that these protein powders, contain other ingredients as well. Sugars, artificial flavorings, thickeners, vitamins, minerals. The amount of protein per scoop that they give you, with these products can also vary. It can be anywhere from 10 grams to 30 grams. And supplements used for building muscle contain relatively more protein. So a lot of these pre-workout things and people that actively weight train and stuff have a lot of protein in them. And then supplements that are used, for weight loss may have less protein. But there are some risks to consider with these protein powders. So this goes for all the supplements, actually. A protein powder is a dietary supplement. And the FDA, I've said this before, the FDA leaves it up to the individual manufacturers to evaluate the safety and the labeling of these products. So there's really no way to know if a protein powder actually contains what the manufacturer claims it contains. So you have to have some amount of trust. We don't know long-term effects. There's limited data on the possible side effects of high protein intake from supplements. For some people, you're going to have digestive distress. Remember, we said some of these come from a milk-based protein. So you might have GI bloating, diarrhea, especially if you have any milk intolerances. And some of these powders can have a lot of sugar, which means a lot of calories. Some have very little added sugar, which is good, but some can have up to like 23 grams of sugar. So if you're trying to lose weight, this is not something you would want to do. Can lead to weight gain. It can also spike people's blood sugar. And again, the American Heart Association recommends a limit of about 24 grams of added sugar per day for women and a limit of 36 grams for men. So really important to label read, I think, when you, if you are to consider a protein powder. The other thing I'll tell my patients is, and sometimes it comes up on routine blood screening, is where we notice their kidney function has been slightly elevated, which can indicate, remember, when we eat a lot of protein, our kidneys do have to metabolize that, okay? So if you have borderline renal or kidney function, taking a lot of protein can be really hard. So again, I encourage you to talk to your physician, or at least let them know at your physical that you're taking a protein supplement. So maybe that can be part of the routine blood work that they might do on you too. I've definitely had some young men come in who do a lot of protein powder pre-workout. We check their renal function. It's a little elevated, which we wouldn't expect just based on their muscle mass alone. We have them stop their protein supplement, come back, and things have normalized. So I think there can be slight risks associated with taking a protein powder that has a high amount of protein in it. So again, what do we want to aim for? The recommended dietary allowance for protein intake is 46 grams per day for women and 56 grams for men. So I'll just give you a few examples here. An egg for breakfast gives you about 6 grams of protein. 6 ounces plain Greek yogurt at lunch is 18 grams, which is good. A handful of nuts. Remember, nuts have a lot of protein, about 4 to 7 grams. That'll give you milk, 8 grams. And then if you eat like 2 ounces of cooked chicken for dinner, that's about 14 grams. So if you're eating a variety of things throughout the day, it's adding up for you. One that I wanted, another kind of a topic I wanted to touch on, because this has kind of become a little popular lately, is people ask about collagen supplements. Um, and that's a good segue from protein powders. But so what is collagen? Collagen is actually the most abundant protein in our body. It's the main component that makes up several body parts, including tendons, ligament, skin, muscles. So it's pretty ubiquitous. It does have very many important functions in our body, including providing our skin with structure, strengthening our bones. But in recent years, talk of collagen supplements has become really popular, especially in the world of aesthetics, I feel. Um, Most of these collagen supplements are hydrolyzed, which means that the collagen has already been broken down, so it's easier for our bodies to absorb. Um, these supplements primarily come in powder form, but are available in capsules. Um, and there's different types of collagen. I'm not going to get into that, but the supplements will also vary in the types of collagen that they contain. Some of them will contain maybe just one or two types. Others may contain all 5 different collagen subtypes. So what are some of the kind of purported benefits of taking a collagen supplement? Well, one of the biggest ones we've been hearing about is skin health. And again, collagen is a big component of our skin. So it might play a role in strengthening our skin, particularly when we're talking about our elasticity and hydration. And as we age, of course, our body produces less collagen. This leads to dry skin, formation of wrinkles, less hydrated skin. So there are some folks taking this and, stating that it can help with all of these, these benefits for our skin, kind of in the anti-aging world. But there's other benefits too. There's reports that it can help with joint pain, may help prevent bone loss, may boost muscle mass, and may promote heart health. Some of these really need to be studied more to see if those benefits are really borne out. Problem with collagen, it's a very slow process. The turnover, collagen turnover is a slow process. So no matter what your goal is, if you're going to take a collagen supplement, it's going to take probably on the order of 8 weeks or longer to really notice results. What do I think about it? I'm not sure. I do need to do more research on it. This might be a supplement to consider if you're looking for some of those benefits that I just mentioned, especially anti-aging for your skin or for joints. I see people taking this a lot too. But again, you're going to want to try this for at least 8 to 10 weeks. And if you don't notice any real improvement, then I would say maybe don't spend any more money on it. However, if you take it and you feel, if you do have a lot of arthritis and you feel like, hey, I've noticed an improvement in my arthritis pain, my low back pain, my knee pain, it might be something you want to continue taking. So I kind of rambled a little longer, but that's what I have for you today. Thank you for joining me. And I will see you next month as well.